Hello everyone, my name is Abdul-kareem Aisha and I'm currently studying Health and Social Care in the Department of Psychology, Health and Professional Development, Oxford Brookes University UK. And I'm also a member at the Mentoring Research Network, Africa Community of Planetary Partners for Health and Environment. Today we'll be looking at childhood obesity in Africa through a planetary lens. And here we have a couple of agenda. We're looking at the overview of childhood obesity, why it's an issue, and the planetary health approach will be addressed through the biopsychosocial approach. Currently, history have recorded the world's largest generation of children and young people. About 1.21 billion young people were recorded in 2020, and this number was predicted to rise up to 1.4 billion in the year 2026. This rise will be expected to be the highest in lower income countries, such as in Africa. According to the Rockefeller Foundation License Commission, planetary health is defined as the achievement of the highest attainable standard of health, well-being, and equity worldwide. Before the COVID pandemic, decrease in malnutrition and mortality rate of children, as well as increase in life expectancy, has led a lot of people to be of opinion that planetary health is possible and attainable. Unfortunately, the COVID pandemic has unveiled deeply rooted, long and persistent problems. Records have confirmed the high rate of obesity and mortality from COVID-19 earlier this year. Childhood obesity across Africa continent continues to be a growing public concern, as about 24% of the world's under 5 overweight were recorded. Obese children are more likely to become obese adults. Being obese raises the risk of suffering from cardiovascular diseases, diabetes, muscle and skeletal disorders, as well as some type of cancer. Among children, being overweight is associated with a higher chance of obesity, premature death, and disability in adulthood. It is also known to be a major determinant for many chronic diseases and psychological problems, not only the physical health, but also the emotional well-being, low self-esteem, anxiety, depression, to mention but a few. Biopsychosocial approach is a planetary approach that adopts the medical knowledge of insulin with cognitive behavioral therapy to reframe thinking and behavioral therapy to put an end to unhealthy eating habits and at the same time replace them with healthy and effective ones. The biological approach to this will be done via promoting healthier food for older infants and young children, especially through family-based intervention. Parents and children should be educated about the roles of insulin in fat storage and the benefits of avoiding food that might increase their insulin levels during the weight loss process. Simple foods such as candies, sugary drinks, etc., can as well affect the insulin level and should be avoided or kept very low during the weight loss process. Psychological approach to this will be done via cognitive behavioral therapy. The cognitive behavioral therapy should be adopted, and this will enlighten children from reframing their thinking towards weight loss process and dieting. For instance, the concept of thin sulin, that is think thin, thin sulin, helps children to reframe their thinking from thinking of perceiving it as a weight loss but rather lowering their insulin level. Children should be taught to group their food in 4 different, like sweets, grains, vegetables, and fruit, and identify which of them might increase their insulin levels. I'm not on a diet. The term diet is usually associated with deprivation and hunger, and sometimes trigger a first famine mentality and behavior that gives a poor outcome and discouragement. Hence, there should be a paradigm shift, as children should be taught to reframe their thinking from a diet to insulin level mindfulness. Behavioral approach to this is replacing unhealthy eating habits with effective ones. Children should be encouraged to avoid sweets such as candies, as they trigger sugar dependence and craving, which might spike their insulin level. They should also be advised to eat 5 meals per day in order to avoid feeling of deprivation and starvation. And children should be advised never to starve themselves. Here is an example of an estimate of day's meal. And for breakfast, 1 portion of protein and dairy product. Morning snacks, 1 portion of low GI fruits such as berries. Lunch, 1 portion of protein and vegetables. Afternoon snack, 1 portion of nuts. Dinner, 1 portion of protein and vegetables. Thanks so much for listening. Thanks for your attention.